We interrupt your regularly scheduled programming to bring you this very important public service announcement.
Good afternoon. This is CSU College Pharmacy Channel 9 News. My name is Ty.
And I'm Ersever.
Today, Parkinson is a chronic progressive neurological disorder. While the cause of Parkinson's disease is unknown, it is believed that genetic, environmental factors, and aging all play in the role of the disease.
Up to 1 million patients in the United States have Parkinson's disease. In addition, the incidence of Parkinson's disease is age-related, and the prevalence increases with age. Currently, there is no cure for Parkinson's disease, and treatment revolves around symptomatic relief of motor and non-motor symptoms in an attempt to improve the quality of life. Some of the adverse effects include, with the use of the current available anti-Parkinson medications, include muscle spasm, upset stomach, and tolerance to the drug.
Currently, medical marijuana in the form of Maranoid has only been approved for the FDA, used for appetite stimulant, and for relief of nausea and vomiting. However, more and more studies have been conducted for use of medical marijuana in other disease states. One such study has shown beneficial effect of medical marijuana in the management of Parkinson's disease.
Please welcome Mr. Edmund Cordova, who has important information about the studies involving Parkinson's and the medical marijuana. Mr. Cordova, tell us a little bit about the study.
Hi, my name is Edmund, and I had the opportunity to evaluate a study regarding the effects of medical cannabis on pain in patients with Parkinson's disease. We observed patients with Parkinson's disease who used medical marijuana using a vaporizer. A baseline assessment was taken for each patient, and each patient was also evaluated 30 minutes after the administration of marijuana. Each of the patients was given a control dose of marijuana of 1 gram, in addition to taking their anti-Parkinson medications. The results were evaluated using pain questionnaires such as the Pain Rating Index, the Quantitative Sensory Test, and finally the Unified Parkinson's Disease Rating Scale to evaluate motor function. Based on the results of the study, we found that the treatment with cannabis may improve motor function and lessen subjective perception of pain in Parkinson's disease. While the study does show promising results, we believe that additional studies do need to be conducted in order to be approved for the use in Parkinson's disease. Thank you.
While this study showed invaluable results, there are several points to note about the use of marijuana. Medical marijuana is available as oral drugs, injection, solution, and by smoking. In the state of Illinois, patients who are approved to the use of medical marijuana are allowed 2.5 ounces during the period of 14 days. In addition, patients who have any previous history of hypersensitivity to cannabis should avoid using medical marijuana. Patients with history of heart disease, substance abuse, and mental illness should speak to their physician before using marijuana.
For patients who are taking warfarin or antidepressants such as tricyclic, serotonin selective reuptake inhibitor, should speak to their doctor before using medical marijuana. Some of the side effects include cognitive awareness, such as mental alertness, mood changes, hypotension, or hallucination. Patients who are receiving THC should avoid using any machinery.
Thank you, Mr. Cordova. Well, that is all the time we have today for medical marijuana. We now return to your regular scheduled program, The Flash.